This is Dr. Lopez Tan from Legacy Hospice. I've been asked to explain one of the most commonly asked questions about death and dying and hospice care. Why do we give morphine at the end of life? There are many fears and misconceptions about what morphine does at the end of life. First, let's talk about what happens in a dying patient regardless of the cause of death. The heart and the lungs are the last organs to fail, and when this happens, shortness of breath and anxiety can cause significant distress. In fact, the absence of a pulse and breathing effort signals death. But before this happens, the most common symptoms of confusion, anxiety, shortness of breath, and pain often occur. On top of that, the nervous system will release hormones to attempt to revive the body, leading to what is commonly known as terminal restlessness. Morphine is an opioid and is the most commonly used drug at the end of life for reasons of effectiveness, convenience, and availability. Other opioid alternatives can be as effective and used alternatively when needed. Now let's talk about what morphine can do. When dosed correctly, morphine provides pain relief, anxiety relief, and can significantly reduce shortness of breath. It can counteract the effects of the stress hormones that are released at the end of life. Why are people concerned about morphine then? There is worry about causing or hastening death with morphine. This is not true because morphine is usually associated with the last moments of a patient's life. It is easy to think of it as a cause of death, even for some healthcare professionals. Just remember that the patient is dying of other causes and the morphine only softens the symptoms of the last moments of life. When dosed properly by a healthcare professional, morphine can be given safely with the intended relief of symptoms, with no hastening of the dying process. Many medical studies have proven this fact. One of the effects of morphine, called respiratory depression, does not occur with small, controlled doses of short-acting opioids, especially when under the supervision of a healthcare professional. If you have more questions on this topic or need more clarification or for any other reason, please contact Legacy Hospice and one of our professionals can help you answer these questions. Thank you and have a good day. This is Dr. Lopez Tan from Legacy Hospice.